At nearly 24 Oregon workplaces that would later suffer major COVID-19 outbreaks, state regulators got an early heads up in the form of complaints from workers or their representatives. State officials inspected just 2 of these factories, prisons, and other potential hotspots before the virus ripped through, sickening dozens in each case. I'm Andrew Thien, and this is Beat Check with the Oregonian. Investigative reporter Rob Davis and business reporter Jamie Goldberg analyzed thousands of workplace complaints and found that state officials missed warning signs at many job sites across Oregon. Davis talked about their story, how they went about analyzing the thousands of complaints, what it says about Oregon and the nation's handling of COVID-19, and why Oregon is sharing more information about its own failings than most of the country. Here's our conversation. Rob Davis, thanks so much for taking time to talk today.
It's my pleasure. Thanks for having me.
So, Rob, you and our colleague Jamie Goldberg obtained some 11,000 complaints that allege coronavirus safety violations at workplaces and looked to see how state officials had followed up. What did you find?
We got the database of complaints that Oregon OHSA, the state's workplace safety enforcement agency, had received from workers all over the state about coronavirus risks in the workplace. You know, there has been a great spread of the virus at work as essential workers in food processing plants, in places like prisons, farms, went to work even as the virus was kind of beginning its spread through the state. And what I wanted to know, given that Oregon, alone among West Coast states, is actually reporting the locations of outbreaks, I wanted to know how many of the large outbreaks that we've seen in Oregon, how many times had OHSA gotten a complaint about something before there was an outbreak? How many red flags had there been? Were there complaints that didn't get a response, that didn't get an inspection between the time that a worker or an advocate complained and the time that an outbreak started? And what we found was that among the 35 largest outbreaks in Oregon, the state got warnings before 23 of them. They got complaints about something, masks weren't being worn, or people were coming to work sick, or people were being required to come to work sick, or there were positive cases and nobody was told about it. 35 outbreaks, 23 warnings. And what I think you could describe as an anemic response from Oregon OHSA in terms of the inspections that were conducted as a result. Of the 23 places where there were outbreaks and warnings beforehand, just 2 had an inspector arrive sometime between the complaint and the outbreak. And so when you're looking at, the potential universe of missed opportunities, and we live obviously in a country of missed opportunities on COVID, but we live in a state that is rife with missed opportunities to control the spread of this virus. This is yet another one. The folks at Oregon OHSA have been obviously overwhelmed by 11,000 complaints. It's unprecedented for them. They have an enforcement workforce of about 75 people, a $13.5 million enforcement budget. And they have been in triage mode with phone calls and letters, that they have been writing, emails that they've been writing to businesses to ensure that they're complying. But when the business writes back and says, "Yep, we're complying," that's it. That's as far as they go. They very, very rarely have actually sent somebody out to verify that businesses are doing what they say that they are.
And unlike other issues where there might be an OHSA complaint, whether it's, about something not being up to code or ladders not being safe or things of that nature, I mean, this has a ripple effect out into the broader community, right? It's completely different.
Well, it does. And I think that's a great point. Nearly a fifth of all the coronavirus cases in the state have a connection to workplace outbreaks. It's almost 10,000 people and 53 deaths that have stemmed from workplace outbreaks. Many of those have happened in prisons, and the Oregon OHSA, despite multiple complaints about prisons across the state, from the very early days of this, when there was just a mountain of complaints that I think arrived almost overnight. One prison, Snake River, where there have been, deaths into the double digits of prisoners there, they got an early complaint about, the lack of social distancing. It's hard to social distance in a prison. And then they got another complaint in July that prisoners had asked guards to wear masks and they were refusing to do it. On the advocate front on prisons, the groups that have sued over this, that they have been complaining that there are few ways to truly know what's happening in prisons and what has fueled the spread there, because getting access to these facilities is difficult. And, you're looking at one of the few state agencies that has the authority to go into a prison and see whether, the claims that the Department of Corrections is making, whether they are true or not. And they haven't gone in. It is, you can pile that on top of many, missed opportunities to stop the spread in prisons. But, I think it's one clear red flag that has not, been seen, not been heeded.
There's a lot that jumps out from your and Jamie's reporting, but early on in the pandemic, it was really the workplace spread that was fueling everything. And you found that the Oregon Health Authority had a role, if they chose to, right, to forward businesses that were the site of significant spread. And did they end up doing that? Did they forward those specific locations to OHSA for investigation?
Like so much that the Oregon Health Authority does and has done on COVID, they're going to respectfully decline to answer that question. The Oregon Health Authority is a notorious black box for a lot of public information, or a lot of information that should be public. And that is yet another one. So we don't know. OHSA, as it's known, does have the authority to refer cases to tell OHSA, you need to get in and inspect this place. Presumably they've done that. They talk about being close partners, but there are no specific guidelines that govern when the state health department refers case to Oregon OHSA, and OHSA wouldn't say whether they've done that. They claim that the information was confidential.
So OHSA did do inspections where they found violations. What can you tell us about where those locations were? Were they high-risk workplaces, and what, if anything, what they determined those employers were doing wrong?
Yeah, they've gotten into, as of November 3rd, they had inspected just more than 200, something like 237. They've conducted 237 inspections. So it's about, since the pandemic began, it's about one a day. And the most noteworthy fines that they have levied were against a couple of businesses that didn't follow state guidance. This was a cafe in Salem and a pharmacy in Lakeview. And these were places where they had gone in, conducted an inspection, had directed these workplaces to make changes. A lot of what OHSA does is meant to be cooperative, right? They're not, they do not view themselves necessarily as, the workforce legal strike team coming in to, trick somebody into doing something wrong and then trap them and whatever else. They try to be cooperative. And, like is evident to anybody who pays attention to the way that the pandemic has been handled by some segment of the population. There has been willful defiance across the country, from the president on down, to this notion that wearing a mask might be a good idea and help control the spread of the virus. And so that from OHSA's telling of it had, been the mindset at these businesses, where OHSA went in and said, here's what you need to do to come in compliance. And the businesses essentially just fobbed them off and said that they were not going to do anything. And at the time that these fines were levied in Lake County and in Polk County, there were no active workplace outbreaks. And so, these were not, the meat packing plants and seafood processing plants that from the very early days were such a source of concern for the rapid spread of this virus. These were just businesses willfully refusing to do what the governor and others had required of them.
What recourse do workers have, Rob, to protect themselves when their employers, in some cases, willfully fail to do so?
That's an excellent question. And I think that highlights the role that OHSA can be playing in this. There is often very little recourse for workers who need their paychecks and have absolutely no choice but to go to work. Employees of essential businesses across the state have taken on risks that many folks are in a place of privilege to not have to take on. It has been, and I think that you see this in the response that everybody is kind of borne witness to across the state. We had a pretty rapid uptake of an entirely new world order in the state in terms of, what was socially acceptable and unacceptable, from whether you're wearing a mask when you're walking the dog to having the mask on at work, establishing plexiglass dividers, moving things to remote work, or, trying to reorder the output at a particular workplace to make sure that if you were producing two items and one required workers to be close together and the other didn't, that you prioritized, the production that allowed for social distancing. And so, it has been just a time of huge upheaval, and there has been, clear uptake at so many workplaces across the state, but it remains to be seen, I think, how clearly that message is still consistently being received, even in places like state-run facilities,
right,
where outbreaks continue to fester.
And these are so many ways these are people who have been accused or convicted of crimes, but are kind of shunted to, the bottom of the pile in society, right? And they're bearing the brunt of it.
And, the virus doesn't stop at the prison walls when workers go home either. And so, like so many things, when you look at this from kind of an analytical lens, and it just, there's just one missed opportunity after another. I do think that it is worth noting, that it is to the state's credit that we are able to even know this. Myself and other reporters across the state very early on made it clear to the governor and to OHSA, the state legislators, and all the rest of it that transparency on the pandemic was going to be exceptionally important, that it was, in fact, a matter of life or death. And the result of that has been, despite OHSA not answering plenty of questions and not releasing plenty of information, they are saying where these outbreaks are occurring. And it allows us to not only know where the senior care facilities are that are hotspots, and what is going on in them, and to understand the depth of the suffering in those facilities, the depth of suffering in the state's prison systems, and the spread of the virus throughout the workplace. That's not information that, I've got colleagues in California who are suing to find out where workplace outbreaks are. And, state officials, county officials are just delaying. And so we are able to, at least in Oregon, and it is not often that Oregon is unique on the West Coast in going further than the other states. I mean, it is just a welcome ray of sunlight here that we know where these outbreaks are, and that we can see whether OSHA complaints have been effective, whether workers' complaints have been heard and responded to. That's just not something that you would be able to know if you lived across the river in Washington, which, by the way, has conducted way more inspections than Oregon.
Let's take a break and come back and talk more with Rob Davis, investigative reporter at the Oregonian and Oregon Live. I wanted to ask about another topic we've talked about, kind of racial disparities in the infection rates here in Oregon, and it's a national trend as well. But I mean, can you talk about the nexus of, what do we know about the types of workplaces that have seen some of these complaints, and how that fits with the racial disparities we've seen? Is one driving the other?
Absolutely. What you see when you look at where these outbreaks have occurred, they have been dominated by the prison system. 4 of the state's biggest outbreaks, 5 of the state's biggest outbreaks have been in prisons. But then it is places like the French fry plant, farm, fruit packer, seafood, a couple of Amazon warehouses, Walmart distribution center, the food supply system. It is places where workers are often undocumented and feel like they have no recourse at all. Where the idea of filing a complaint to begin with is just not an option, not something that people feel like they can do. And so as you go down the list of where these outbreaks have occurred, and the prison system, which is, the worst outbreak in the state is at the Snake River Correctional Institution in Eastern Oregon, where there are more than 500 cases that have been tracked to that ongoing outbreak. And so, it is, the essential workforce that has been kind of put on the front line of this and is suffering as a result, so that, store shelves stay stocked.
And those are disproportionately people of color in Oregon.
Absolutely.
The pandemic, Rob, has placed everyone under, extraordinary pressure, and we're facing just unreal circumstances, but now we've been living in it for a while. Do you think your reporting has shown us anything broader about how Oregon protects workers? Or is it just this is chalked up to exceptional circumstances?
I think that the indictment here is of our country's failed response to COVID-19 and a pandemic that is unprecedented in our lifetimes. I mean, it would be hard to find ways to say that we could have done it worse. It has been such a national nightmare of a response. And we are now in the thick of the worst part, the worst surge. Oregon is breaking records on a daily basis. We've sort of become inured to it. And the toll that workers have paid in Oregon is the toll that workers have paid in, the 49 other states as well. Nationally, OHSA, which has not had, the federal OHSA, which has not had a director since January of 2016, when Donald Trump became president of the country, it has not issued anything other than recommendations and guidance and non-binding, response to the pandemic. And so, Oregon, in that respect, has gone one step farther. It's one of 3 states that, a week ago, adopted temporary rules requiring things like, for workers to be notified by their employers when there is an outbreak. Again, Oregon's one of 3 states in the nation with that. And it would be easy to envision a federal OHSA that was operating and prioritizing the lives and livelihoods of workers. They could have acted to adopt rules months ago. And that hasn't happened. And so, it is on this pandemic, one breakdown after the other. It's hard to honestly to see, because when you get into it and you can see the pitfalls and how many of them we fell into nationally and in Oregon, so many people have died as a result of it.
I'm sure people will study this in years to come. If we did this, then X amount of lives might have been saved. But, that's cold comfort for so many people around the country.
I mean, it's just the mask turning into a political weapon. It's just one of the saddest parts of all of this. And, it is workers and all the rest of us that pay the price for that.
Well, Rob, thank you. And thank you to Jamie Goldberg for your reporting. This is tough stuff, but it's really important. And thank you for taking time to talk about it.
Hey, thank you for the opportunity.
Thanks for listening to Beat Check with the Oregonian. I shared a link to Rob and Jamie's story in the episode notes. If you want to know more about how COVID-19 is affecting people, schools, and the economy, you can subscribe to Oregon Live for access to exclusive stories and analysis. Go to OregonLive.com/pod supports. You can also subscribe to our free text message service to get the latest updates on COVID-19. I shared a link in the episode notes. If you like this show, leave us a rating and review in Apple Podcasts, or tell a friend. Help spread the word. Until next time.